It's evening time. You're ready to sit on that couch, but your neck, it's on fire. Your shoulders, on fire. Your arms, they're heavy. You got tingling happening in the fingers. And maybe this is presenting itself in the morning, but by the evening, it's way worse. What's going on? What's the issue? Why is this going on? Watch my video. I'm going to explain to you what's going on, but more importantly, I'm going to give you my protocol on how you can deal with this. I guarantee you, your neck has been carrying your head for anywhere between 10 to 16 hours and it's fatigued, and you need to know what's going on. Watch my video today. I'm going to show you 3 stretches and 1 simple protocol, and it's going to change your evening. My name is Dr. Alykhan Shariff. I'm a local chiropractor at Oshawa, Ontario, and my clinic name is Infinite Healing Chiropractic and Wellness Center. And if you've been watching my videos, welcome back to my channel. And if you haven't, this is the time. Like this video, subscribe to this channel, because I'm going to educate you on the things that you need to know on how to optimize your health. And today's video is going to be a game changer for you. Now, whatever stretches I show you today, make sure that you review these with your chiropractor. It's always good to have a healthcare practitioner that knows your condition, knows what you're presenting with, and can analyze and review and make sure these are the best stretches for you. Now, let's understand this. From the moment your head is lifted from the pillow to the moment it returns to the pillow, the cervical spine is under a sustained axial compressive load. What does that mean? Gravity, standing, all of that is putting pressure on your head, on your neck. In a cervical stenosis patient, they usually present with forward head posture, which means the natural weight of their head is now amplified. And so by the evening, that C5, C6, C6, C7, those discs, they've lost their maximum hydration, and the nerve roots at these levels have been under the maximal compressive force that they will experience all day. The disc height at C5, C6, and C6, C7, it's at its daily minimum, which means the foramina, where the nerve goes through from exiting the spine, from leaving the spine and going to the body, that hole, that foramina, is now at its basic minimum, which means the nerves are facing the most amount of pressure by the evening. The upper traps, they've got to work hard now to maintain that head posture. So they're going to be on fire too. So by the evening, the upper trapezius is fatigued, it's hypertonic. The nerves, they've been compressed, they're on fire. Your whole disc area has reduced in size, and you're going to feel the worst neck and shoulder pain by the evening. It's time to change this. Let's not waste any time. Let's get right into what these stretches are. The first one is cervical traction. The cervical towel traction opens up the evening protocol for you. And it's the same thing as my morning protocol because it's the most direct cervical canal decompression. So if you haven't watched my morning video, make sure you watch it. And as you will see in my demonstration, the towel is under the occiput from below. The hands are above the shoulders pulling upward, and the chin is slightly tucked. And so the occiput is right here, and you're going to hold this for about 30 to 40 seconds per set. Let me show you how to do this stretch. Today what I'm going to show you is a cervical traction stretch. Great for people that have C5, C6, C6, C7 issues. It helps to decompress that spinal canal. So let's show you the cervical traction stretch. Basically what you're gonna do is you're gonna take a rolled up towel and you're gonna grip that underneath the base of the skull, the occiput area. And once you've got it there, you're going to then have a gentle distraction up. But before you do, you're going to tuck the chin in and then distract up. And it's a great stretch for that cervical area that you can do. So you can do it seated, you can do it standing, you can do it any position because it's all requiring just upper body work. Now we're going to go into stretch number 2, and it's the easiest one to do. It's the supine cervical traction. This position is the most passive cervical decompression available, but you can do it in any home setting. And it is so simple. And it is one stretch in the entire series that requires the least amount of effort to produce the canal decompression that you're looking for. So you're going to see in my demonstration that when I show you how to do this, that you are lying flat on your back. A small rolled up towel. You don't want a big roll up towel because it's going to put your head into too much extension. A small roll up towel is placed under your natural cervical curve. The head rests on the surface behind the towel. And that's the entire setup. Everything else is gravity. Gravity and time. So with the head resting on the surface and the cervical curve is supported by that rolled up towel, the weight of the head, 4 to 5 kilograms, that's probably what your head weighs, creates a gentle distractive force through the cervical segments, all the way from the occiput down to C7. And the cervical vertebrae, they're gently separated by the weight of your head and gravity helping you. So that means that the C5, C6, and those C7, C6, C7 disc spaces, which have been under compressive load for the entire day, they begin to separate under this passive traction. It is such an easy, simple exercise. And the foraminal dimensions, remember I talked about that, where the nerves go through, they also begin to increase. And all you gotta lay there for is 2 to 3 minutes. Eyes closed, completely passive, just relax and let the stretch do what it needs to do. Today we're gonna show you the supine cervical traction passive stretch. There's no effort required for the stretch. It is so simple to do. You're just going to take a rolled up towel, nothing too thick, because if it's too thick, it's going to throw your whole cervical spine into extension, and that's going to start to narrow your canal. So you just want to roll up a towel, one that's going to be placed underneath the neck area, okay, to help with that lordosis, that curvature in the neck. So very, very simple stretch, and Sarah here is going to demonstrate how to do this. And you want to basically hold the stretch for about 2 to 3 minutes. Doesn't require any effort at all. So let's show the stretch, okay? So you can do this while you're in bed. You can do this laying down, obviously. The towel needs to be underneath the cervical spine. And basically it's supporting the cervical spine. The head is coming down. It's a very passive stretch that we're doing. And all you do is just lay there. It's as simple as that. And you hold this position for 2-3 minutes. And it's a very nice stretch to help stretch out that cervical spine and help to start to bring back some of that lordosis, the curvature in your cervical spine. The third stretch combines the chin tuck that we talked about and lateral flexion. And it's similar from the morning protocol, but it's a single combined movement, more therapeutically specific for C5, C6, and C6, C7 than either movement performed alone. So as you're going to see in my demonstration, the sequence has 2 steps that flow into one held position. So there's 2 steps to this process. Step 1, you're going to draw the chin back. Horizontal retraction, okay, similar to what I established in the morning protocol, but you're going to hold that chin tuck. Then pick a side, okay, once you're holding that chin tuck, and let's say it's the right side, you're going to then tilt the right ear toward the right shoulder. So holding that chin tuck in, you're going to tilt, okay, and you're going to hold that for about 20 seconds. Then you're going to return to neutral. Same thing, chin tuck, and now repeat it on the left, okay. This is it. That lateral flexion that you're doing opens up the foramina on the opposite side. But the chin tuck targets C5, C6, and C6, C7. So this now becomes a level specific stretch. So again, to review it, you're going to bring this back. And then while it's back, you're then going to tilt. And you're going to hold. And then you're going to come back to neutral. So you have the cervical towel traction extended, and you're going to hold that for about 30 to 40 seconds. 3 sets. Then you have the supine cervical traction that you're laying down 2 to 3 minutes. Completely passive, gravity doing what no other really active technique really has to do, because gravity does it. And the chin tuck with lateral flexion combined, which makes it more specific. 20 seconds each side, one of the most specific foraminal opening stretches available for you in the evening position. And really, how much is it going to take? 10 minutes? Maybe 10 minutes. 3 stretches. And this trilogy of stretches is a game changer. But while it provides you relief at night, what it doesn't do is that it doesn't address the arthritic degeneration, the disc degeneration, the ligamentum flavin thickening that also is existing. And this is where you should also combine your stretches with a therapy plan. You should be seeing a practitioner. I, as a chiropractor, see tons of patients and I help them with their cervical stenosis, with C5, C6, C6, C7 impingement. And when I see them coming in to see me, yes, we'll put them on a stretching protocol. Yes, we'll put them on an exercise protocol. But the understanding is your stretches and exercises do not replace the care that you need. It works in junction together. And I'll see patients, and maybe you've done this, maybe you've done some stretches, but you're still finding the problem coming back. It's not going away. It's a recurrent thing. There's a reason to that. That damage isn't going away. That damage isn't being worked on. And some of it may be permanent, but there's improvements that can be made, and a stretch is not going to do that. And the stretches are going to support the care. They work together, hand in hand, and that's why you need to do them together. You can't say I'll do one and not do the other. So the combination is the difference changer. And please make sure that you are seeing somebody. My name is Dr. Alykhan Shariff. And hopefully you found the content to be extremely valuable. And I'm going to ask you to like this video. I'm going to get you to subscribe to this channel if you haven't yet. I'm also going to ask you to throw down some comments, because I'm always looking to read the comments, answer any questions you may have, any concerns you may have, and any feedback you may want to give me. My clinic name is Infinite Healing Chiropractic and Wellness Center. I'm located in Oshawa, Ontario. I'm looking forward to seeing you in my next video to help educate you on how we can take better care of yourselves.